Hey, I am Rebecca and I will be doing this video for control bleeding and bandaging for my KINE 220 first aid class. This is my friend Madeline. She's going to play my victim for the video. And so first thing you want to do is you want to walk up to your victim and introduce yourself, say that you are first aid certified, and see what their issue is. And so that'll look like this. Hey, I'm Rebecca. I'm first aid certified. I'm here to help you with an issue that you're having.
I have a cut on my arm.
Alright, so first you're gonna sanitize your hands or wash your hands with soap and water, but for the purpose of this video I'm just gonna use hand sanitizer. You're gonna rub that all in and make sure they're good and clean, and then when they dry you're gonna place your gloves on. And we're going to put these gloves on to make sure that we don't spread any bacteria or risk getting infection in her cut or on myself. And so then after the gloves are on, we're going to inspect the cut, and it's just a small cut, and so it'll be easy to treat. And first we're going to wash it, and we would normally do it with soap and water. Just for the video we're going to use hand sanitizer, so put that on there and rub it in, make sure it's nice and clean. And then we are going to use a sterile dressing to cover it up, and I'm going to use a gauze pad. So we're going to take this, place it on the cut, and hold it there for a couple of minutes and apply some pressure. Make sure the bleeding is gonna stop, and if you need another, like if the bleeding's not stopping and you need to apply another gauze pad, you would just place one on top. You wouldn't remove the one you already have. Doing this would rip off a scab that's already been formed. So you wouldn't do that, you just place one on top. And then so we see that the bleeding has stopped, so we're gonna take this roller gauze and wrap it up to make sure it's secure. Make sure this bandage doesn't go anywhere. So we're just gonna hold it firmly and start wrapping it up like this. And we do this to make sure it's secure, and when they move around later, that it'll stay bandaged and no bacteria or anything will get inside the cut. So we're going to do this in the front and behind the gauze to make sure it's secure and all this. And then when we're done, we can just tuck it in, and then we'll ask our patient to move their arm around, make sure that it's nice and secure, it's not too tight, not too loose, and whatnot. So is it good? Cool. So then after we have all that done, your patient might have to go to more care, like at the hospital, or we might have to call an ambulance. But for right now, she should be good. And then we're gonna remove our gloves the way we know how. And after we remove our gloves, we are going to dispose of them in a safe, like plastic bag, and dispose of them the correct way. That way we won't spread any diseases and all that. So that'll be it. Thank you.